Got it done successfully, boys.
Quick summary.
So we had a patient who's not, unfortunately, seen a dentist in several years.
So doc will come in, scan in the patient, and this is what I'll get. The doctor will remove all these teeth. As he removes them, they'll either be infected or whatever. They might lose all of this tissue. And then I'll come in and then I'll design something that'll go over it. And this is just a rough estimate of where I want his teeth or her teeth to go.
His teeth were very, very, very mobile. Top and lowers, unfortunately, whichever ones he was holding. Presented with severe periodontitis.
You'll see one of the steps right now. Right now, they just sent me a suture scan. So this is the patient's lower scan with the scan caps. We use these scans to identify the direction of each implant.
In this case, we ended up doing 6 implants on the top, 6 implants on the bottom. Same day we cleaned, of course, all the infection. Got 2 pterygoids in.
And I'll take this scan and align it to the provisional scan they took earlier. Get to see where if I got close with my design, which I kind of did.
Great implants on the top, great on the bottom. We should be getting some temporaries pretty soon here, and it should be a great result.